Hey there, are you a couples therapist that sometimes has your couples in sessions behave in a really strange way? It feels like they're being defensive, but you're not quite sure what it is. Or have you ever wondered how you can use biofeedback apps in order to help your couples control their physiology and thus how they come across to one another? Then you're going to want to watch this sneak peek into one of the sessions from my mentorship program. So, with that being said, take a look.
And not sure. I think they both really want the other to understand how they make each other feel.
Sure. So your question then is, what do you do when there's this thing like, I can't say anything anyway? And you wonder, should I do the aftermath of a fight stuff so that they can process it? Is that fit for this? But how do I respond to this dynamic of nobody can really say anything? And so now, again, they're triadically pulling you into it. Is that the main,
Main
or is there
question.
more?
No, I guess you touched on the question. Yes, because I think one of my questions it will be maybe what to do more in the moment where someone's kind of trigger takes over and they really can't listen. But I think my main question, yes, with this couple is how you summarized it of how do I help them move forward, pull myself out and help them talk about this.
The goal of these meetings is not so people are getting strict like Gottman advice. That's why I didn't really name it anything that's within that lane. It's more, we've had developmental people here, plenty EFT people here, and everything in between. I even find it refreshing to hear this variety of perspectives. So it's not a Gottman necessarily consultation time.
That's
Uh,
good to know. I wasn't sure whether other things were going to be brought in or I can ask about other
all the
things.
time,
Good to hear.
all the time. I agree, especially the focus by the brain on the negative. And that's a piece of probably what we have here. And the 5-to-1 ratio is a good one to remember. It's probably something that these guys are not bothering to do for assorted reasons after their time together, if it's that negative. So I think keeping that in mind, we want people to get to 5-to-1, but if you're not really feeling thrilled about the person you're talking to, you're not going to want to do 5 positive things. If you think about like a neighbor you don't like or whatever, if somebody said, hey, you'll end up liking this person more if you tell them 5 things you like about them, you'd be like, F that. It's the positive perspective in the sound relationship house, that middle one, it's an outcome. It doesn't have a verb. There's nothing to do to cause people to think positive. Sometimes with couples, by interjecting positive stuff in there, it'll get a little bit further. Other times though, they'll shoot it down because of what I just told you. And because they don't trust this person anymore to do anything positive. Okay, to organize my thoughts, I was going to say something about defensiveness and then about being domineering. So the defensiveness thing, remember there are 2 ways that people can be defensive. One is by counter criticizing. And that one we know well. The other one is the innocent victim. His response is defensive, but it's actually a little bit of what we would genuinely call stonewalling. Stonewalling, people label it wrong all the time. And what people are usually is they're flooded in retreating, like physiologically and emotionally. Stonewalling is a deliberate act to stop further discussion in such that it escalates the tension.
Yeah, I did.
So him going, there's nothing I could say to say anything. I'm just not going to say anything at all then. How do you like that? That's stonewalling. It's
Made that.
deliberately stopping the discussion, but it's raising the tension. All right. So stonewallers, when they're doing that, what we know is they're usually physiologically overwhelmed. That's where I think things like biofeedback can really help. My favorite biofeedback app for this kind of thing is called Coherence. And it looks like this on the App Store. And it's Coherence, like Heart Rate Pro, but it's got this heart thing. This photo's from a little while ago, but that's it. And it's $10 or something. Okay, so definitely do this on yourself first. You buy the app and you're going to put your finger over the camera like this. All right. And it's going to shine a light and it's going to look at your heart rate. So that's how you do it. So you would have them hold their phones such that you could see it like this. Okay. Or maybe they could see it. Maybe they could do it and they could monitor it. And then at times where they're displaying these behaviors that seem problematic, if not just flooded, but even just defensive, what have you, have them look at the app and do breathing in the way that the app is showing them how to breathe. When they turn on the app, you're going to see this. And this is a screen recording I made of my app. Now, this is my heart rate. I'm going to hit the video in a minute. But what happens is every time you breathe in, your heart speeds up a little. And when you breathe out, it slows down a little. So the distance between these beats is always changing just a little. So notice as we breathe in, we can start to control our heartbeat. with the whole premise being, as you control the oxygen coming in your body, you can control your heartbeat, and thus you control the amount of oxygen getting into the brain, which is the problem. Okay. So that's how the biofeedback works, is we use our breathing to control our heart rate, which controls how our brain is working. So we need an app that monitors the heart rate and tells people when to breathe. So this is a screen recording I made one time. And what it's going to be doing is I hit OK, and now it's detecting my pulse, and it's looking at the cameras shining in my finger. And I'll tell you what this is down here in a minute. Okay, so there it is. And it's getting its bearings. Okay, and now I've got it covered up nicely and somewhere around there. All right, so now what you're going to have them do is as the ball goes down, breathe out from their stomach. The ball goes in, breathe up. And the ball goes down, breathe out. And so you have them watch this little thing at the bottom. And what this is in the middle, it gamifies the whole thing a little bit. The machine can tell if you're starting to control your heart rate and you're getting control of it. And as it does, it's giving you like a cumulative score. So what they want to do is breathe in and out here. And this gives them feedback about how good they're controlling their breathing. That's why it's biofeedback. Does that make sense?
Yeah.
Okay.
Yeah. Is this in lieu of sending them out? Because when I was reading about how you need to send people out for 20 minutes at a time, that seems like a kind of a wasted amount of time where they're just out in the lobby feeling left alone. And
Yeah, often. You would definitely send them out if they are really escalated and they need 20 minutes. They're not able to even interact with the app. They are just physiologically in fight or flight. So then we would send them away. But if they're just physiologically overwhelmed, often this is the feedback that people need to where they'll over time start to pair, oh, this is the behavior I'm doing and this is how I'm behaving, but look at what this machine's telling my body is doing. And then they get their body under control using the machine and they go, oh, I feel better too. And that's the feedback.
Really like the visual and the breathing component of it.
And there's a few others. This is just one that we've come to use. There's probably millions that are new since we recorded this video.
so you'll
But
give a client your personal phone to use
no,
it.
I'll have them download it for themselves because I want them to do it later on their own without me.
So they have to sign up, pay $10 and then use
Yes.
it.
That's one thing about Stonewallers and physiological overwhelm and using biofeedback all in one. The other thing about these two, though, is the idea of being domineering. And so domineering is a very subtle form of power and control, and it's a form of contempt. And I find domineering very hard to pick up on. And I don't usually really notice this is what's happening until after a few sessions where you'll realize there's this overall thing, this power differential, and it just has this overarching control and contemptuous eye roll to all of their interaction. And there's something negative about it, but it's not like overly mean. It's just controlling. How you respond to that, like contempt is battery acid to a relationship. How you respond to it, I think, is your personality as a clinician in the room. You can get people one-on-one. You can just do the antidotes to criticism and have them do those things. But I find with some of these people, if it's really a habit and you can tell that's how they operate, I will sometimes have to just, at the risk of losing rapport, meet with them one-on-one and say, look, you're controlling stuff. Help me understand how that's getting you what you want. And what's this about? So that's how we would label it, is maybe domineering. If you want to know more about it, you can go look at the SPAF coding system in the level 2 manual. It's in the beginning, I think in like chapter 4. And it lists a bunch of different ways that people behave when they're domineering. It doesn't really help you with the treatment of it, but it identifies what it is. It's the only place it lives in the manual. Okay.
I've been seeing them for a while. This is the first time we're after a session. I was like, oh, that was contemptuous what she was doing.
Yeah.
Like it clicked at those moments. I was like, oh, okay.
Yeah. It's a power and control thing is what she's doing. No, come at me like this. And then, but I think he's playing the innocent victim in stonewalling as a way to get back at her. So sound good? Enough to think about there?
I think so. Thank you.
Hey there. So I hope that was helpful to give you an idea about a really unique situation that comes up a lot in couples therapy, but isn't really explained. what to do when people are behaving in a domineering way, what to do when they're not in control of their physiology, and how you as a couples therapist can use apps to make it better. Now, what you're seeing is a taste of what it's like to work in my mentorship program. And it's right now available on this page that you see right here. What basically you get 3 months of access to weekly roundtable case consultation sessions. It's one thing to know the material, but you have to be able to apply it. So that's why I created this mentorship program where I really help you walk through the material so you can apply it to real life situations. That's what's going to make you a great couples therapist in your area. You have access to our on-demand course training library full of unique situations like this that are honestly quite common, but no one has ever really explained. And we're there to help you walk through it step by step. So if you scroll down this page, you're going to get access to the consultation times, Gottman level 1, as well as level 2. Those are the 2 pieces that I maintain that you really need to feel super comfortable and competent as a couples therapist. And you can add many other methods on top of it, almost like scaffolding. It is there to help you through all of it. You also get access to our library and my referrals to results course, because so many times I've had people approach me and they say, I'm doing great couples work, but I can't get new clients. And this is why I created this. After getting certified in 2 different marketing methods, I'm showing you exactly how I've helped other couples therapists build their practice in many parts of this country. You also get access to my high conflict couples masterclass, where we had some guests come in and talk about some really common but difficult situations. So you'll see on this page, it's currently 91% off. There is a money back guarantee, so there's really nothing to lose if you want to come try it out. If you have any questions about the roundtable meetings, how they work, if you've bought other stuff and you want to apply it to this, just take a look at the FAQs. But for now, get access while we still have room in this program. The roundtable meetings absolutely fill up all the time. And then we go ahead and close this down. So if you're on this page and it says it's closed and it's full, that's just how it is. And then you'll be notified if you're on my list when it opens again. But if you find it like this, jump in, try it out. We're happy to have you, and you can decide if it's a good fit. So I wish you well in your couples therapy work. It's not easy, but you can keep at it and get better. It's actually quite rewarding. So I'll talk to you soon. See you in the next roundtable meeting.